Most often, everyone comes to me because they have a symptom. What they basically want to do is to talk to me about their problem. And the very thing that brings people to me is what I'm not interested in. I'm never interested in treating the symptom. I'm interested in finding out what caused the symptom. Therefore, we need to examine you in a very different way. We need to have the availability to go clear down to the moment you were born, if your body will allow us to. And a symptom, I like to liken it to a young woman who wakes up every morning with a headache and goes to sleep every night with a headache, and she has it for years and years. So it's chronic. And eventually, at some point, she says, I can't live my life like this. I need to seek help. And the first person she goes to says, what's bothering you? And she says, this is my problem. I got headaches. This is what you need to fix. And they give her some type of aspirin-like compound. And like a miracle, the pain goes away. First time in her life, she has no pain. But when the aspirin wears off, the pain is back again because of the chronicity of the headaches. So she continues to take aspirins day in, day out. And then one morning she awakens. She has a hole in her stomach from the acid of the aspirin. She still has the headaches. That's treating a symptom. Poor analogy, but an analogy nevertheless. And that's what we don't want to get caught up here at the Institute. So the object is always find the cause. And it's interesting because we really examine patients from a point of nothingness. When a patient comes into the Institute, they're never asked what's bothering you. It's our job to tell them about themselves without their saying anything. And at the end of the examination, when they're really frustrated because they want to talk, then we say, why did you come? And we link up what we saw with what they have. And we only treat what we saw, and in time what they have will begin to go away. And each person on this planet is an individual unto themselves. And following the blood group menu, the subblood group, the Rh factors, the H1s, the A1s, it talks about you, the individual. What foods are right for your body, what exercise is right for your body, how should your mind process information? What acids did your body come along from the moment of birth liability? So once we have this information, we know how your body should function when you're perfectly healthy. The blood groups, again, I can't emphasize it enough, the subblood Rh factors only tell us how you should function when you're perfectly healthy. No one ever comes to me perfectly healthy, so you can't eat that way. And that's why the rest of the examination is so important. The pulse diagnosis, the iridology, because all of this talks to us about the inherent weaknesses that are in your individual body, because you're a living being. And this program has to keep up with the individual needs within your body. Why treat the symptom? Why not locate the cause? And this is what separates us from the rest of the world. We see the body as a whole.